Hello everyone, I am Dr. Prachi Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Pregnancy is an important life event. All women dream of a safe, uneventful pregnancy with the birth of a healthy baby. But sometimes, unfortunately, this dream is broken by a miscarriage. So today I am going to talk about miscarriage. So what is miscarriage? What are the causes of miscarriage? What next after a miscarriage? So what is miscarriage? Miscarriage is once you become pregnant, once you conceive, if that pregnancy doesn't continue beyond a particular weeks or months and end up with a miscarriage wherein pregnancy terminates and no more you continue the pregnancy and have a healthy baby. So anytime after you conceive, if the pregnancy is interrupted, like after a month, after 2-3 months, after 4-5 months, the unfortunate event, then this is called as miscarriage. So the miscarriages are of different types. So the miscarriage which we call threatened miscarriage is something where there still might be a chance of helping the pregnancy to grow further and stopping the process of miscarriage. We call it threatened miscarriage. Then there is another term which is used is called as complete miscarriage, wherein we see that when the patient comes and when we do the scan, there are no evidence of pregnancy or there is no baby inside the uterus, or there are no any products of conception inside the uterus, then we call it complete miscarriage. Another term which is used is incomplete miscarriage. Incomplete miscarriage means either the baby has stopped growing, or if there is lot of blood inside, or there are products which are left after the pregnancy. So this is called as incomplete miscarriage. So incomplete miscarriage requires some treatment to complete the process of miscarriage. Now we'll see why the miscarriages happen. So miscarriage can happen because of multiple reasons, and it is very important to find out the reason of a miscarriage. With a single miscarriage, if you are young, there is not much to do, or there is nothing extra which investigations which we advise generally, but we will take the decision only after complete evaluation of the pregnancy which ended up in a miscarriage. So what is this complete evaluation? So the complete evaluation will include blood test of the lady who had a miscarriage. They might be related to your hormones like thyroid, sugar levels, also may include sometimes genetic test and the routine CBP and infection screens. Sometimes we may also advise the husband of the lady to undergo some blood test and semen analysis. Then we advise a complete 3D pelvic ultrasound of the lady to rule out any problem related to the uterus or the lining of the uterus, which is usually done mid-cycle, that is after 9-10 days of your cycle. And sometimes there might be some extra immunological blood test, some other extra genetic test like whole exome sequencing or extended carrier screening based on your history, your reports and your scan reports of that miscarriage. After the complete evaluation, we may come to a conclusion for the cause of the miscarriage. So the cause of the miscarriage will vary depending on how many weeks or how many months you are pregnant at the time of miscarriage. So initial 3 months, first 3 months of pregnancy, the most common cause of miscarriage is genetic cause with the baby. So 80 to 90% of the first trimester miscarriages are because of some genetic problem with the baby. The other problems of the miscarriage which happens in first 3 months can be endocrine problems like thyroid issues or uncontrolled sugars, or there might be immunological factors like some patients with SLE or some patient with autoimmune thyroiditis or rheumatoid arthritis, they have autoantibodies and that may also cause miscarriage. So these are immunological factors of miscarriage. Then there might be some infections which may cause miscarriage, especially urinary infections and vaginal infections. Then coming to the structural problem of the uterus, sometimes there might be problem in the uterus like septate uterus, that is a muscular compartment like thing which is coming from the fundus of the uterus, that is the central part of the uterus which divides the uterus into two parts. So this septum sometimes is not having proper vasculature to supply for the growing pregnancy. So the implantation doesn't happen properly and it may end up with a miscarriage. So septate uterus, sometimes unicornuate or bicornuate uterus, can result in miscarriages. Then also fibroids, which are benign tumors of the uterus, which are pressing inside of the uterine cavity where the baby implants. So those fibroids which are pressing inside, those fibroids can also cause miscarriages. So these are the structural problems of the uterus. There might be incompetent cervix, means the mouth of the uterus may not be strong enough to remain closed throughout pregnancy, may not be maintaining the length. So what happens is this, as the pregnancy advances, the cervix becomes short and prematurely it opens up, causing the pregnancy to end up in a miscarriage. So this is called as cervical incompetence. Or there might be some other rare causes also, like if the couple is related to each other, like if they are married to cousins, first cousins especially, so we call it consanguineous marriage. So that means you are related to each other by blood, so there might be a chance of carrying the same genetic problems in both husband and wife. So what happens is the husband and wife both are phenotypically or physically normal, they may not have any genetic disease, but because they carry the same genetic pool, there might be what we call autosomal recessive diseases which are causing the genetic disorder, which they both might be carrier of, and they may transmit those genes to the baby. That can also result in a miscarriage. So these are various reasons of the miscarriage. So mainly first trimester miscarriages usually, if happen in a young lady, then we don't advise any further testing. But if it happens like repeated first trimester miscarriage, more than 2 to 3 miscarriages, then we advise to undergo the evaluation even in young patients. So sometimes the older women, like above 35 and all, they have recurrent miscarriages. So the cause for older women who are having recurrent miscarriages in first 3 months, most likely cause would be genetic cause, which is related to their age. As the age of the lady increases beyond 35 years, the division of the chromosome which happens in the eggs, and that same egg which is carrying the chromosomes to the baby, the number of chromosomes might not be normal. So we call it aneuploid. So these aneuploidies result in miscarriages, especially in older women who are more than 35 years of age. So these are the different causes of first trimester miscarriage. Now coming to the second trimester miscarriage, which is after 3 months. So most common causes of second trimester miscarriage is either in the some problem in the baby, like either genetic problem or some structural problem with the baby. The structural problem of the uterus, like septate uterus, incompetent cervix, these are the common causes of second trimester miscarriages. Even endocrine problems like diabetes, thyroid result in the second trimester miscarriages also. Uncontrolled diabetes can cause more occurrence of infections in these women, like urinary infection and vaginal infection. So in second trimester, even the infection is the common cause for miscarriage, but should not result in a habitual miscarriage. So these are the various causes of miscarriage. So what to do after a miscarriage? So after a miscarriage, most important thing is your mental health and your physical health. So please consult your doctor, your fertility specialist. If required, take the support of your family and friends so that you will be emotionally supported and you will feel again hopeful for the pregnancy. Take help of your doctor. If required, the doctor might advise you to have a psychological counseling to help cope up with this emotional stress. So after all that, then the physical issues, which usually will be related to blood loss or the supplements. So the supplements doctors usually give is iron supplements, folic acid supplements, and some multivitamin supplements. So take your supplements properly, take your time, 1 to 2 months to heal mentally and physically. Then please consult a fertility specialist who can guide you properly to evaluate the cause of the miscarriage and in future to prevent these miscarriages. Because what happens is with every miscarriage there is a potential to cause damage to your uterus, the uterine lining, and also the tubes which are connected to the uterus because of infections. There might be some thick bands which may happen inside the uterine cavity, which will again further prevent any pregnancies. So recurrent miscarriages is something which has to be dealt properly. Consult a fertility specialist, get both of your tests done, get proper 3D ultrasound done, find out the cause for miscarriages, and then your doctor can guide you properly how to proceed further. Usually we advise to take a 2 to 3 months gap, advise to take proper diet, nutrition, rest, and the multivitamins like folic acids and sometimes iron supplement. After that, whatever is suitable based on your age, your egg reserve, and your reports, the doctor can advise you, which can be either trying naturally with some extra hormonal support or some extra blood thinner supplements, or it can be even IVF with some pre-implantation genetic testing for the embryos, and again additional hormonal and immunological support for the pregnancy. So miscarriage is not the end of your parenthood dream. Please do not lose the hope. Consult a fertility specialist. We are always there to help you. I am Dr. Prachi at Ferty9 Fertility Center, Banjara Hills, and I wish you all the best. Thank you.